Hi, I'm Peter Leo. I'm a clinical assistant professor of dermatology and pediatrics at Northwestern University, Feinberg School of Medicine in Chicago, Illinois. The shared decision-making algorithm is tricky and it keeps changing. It's a moving target. And as we learn more about each medicine, that can shape and sculpt our ability to talk about them, and it really does affect our choices. I think the truth is we try to lay it out a little bit like a stepwise path. It's like, of course, we're going to do our good education, good, gentle skincare. Over-the-counter care is so important to me. I'm very prescriptive in this. I feel like finding a great cleanser, not just a mild cleanser, one that is hopefully going to do more, a great moisturizer, not just something that's non-scented. I want something that actually has active ability to help the skin. So I kind of refer to this group as active dermatologic care, that we're going to do a lot on that. So that's huge. Then maximizing our topicals. So we kind of go through the different pluses and minuses. Some of that is absolutely colored by my experience. I have other colleagues who might say, oh, I prefer this one. I'll say, this one hasn't been so great for my patients. So we kind of go through that. I love sampling. I like patients to try things, especially with topicals. Here's a couple of options. Will you try one on one hand, one on the other, and tell me which one you guys like better? Which one does the skin seem to respond to? That's a big part of the story. Even if it's not scientific in the broadest sense, we know that the science is there. These are evidence-based to some degree, but there are lots of personal decisions and choices, and that ability to be more precision or personalized, that's huge. And then when it comes to systemics, it's a bit of an abundance of riches right now. We have to think through age is going to affect some of that because we know not all of them are indicated down to the same age range, but then talking about the risk-benefit profile, and again, some of it comes down to my own experience. There are certain medicines that I feel very comfortable with, and I say this one I've used a lot and I have a lot of patients who are doing great with this one. I think this might be a good place for us to start, and then really listening to where the family's at and getting that sense of feedback. I think for me, what's really exciting is that we're in this set of ideas called, I like to call it the virtuous cycle of drug development. We've gotten some new medicines that help us treat it, but that also has allowed us to understand it better, which has in turn led to better treatments and so on. So we're really building it, and it's moving very quickly. I think evidenced by the just sheer abundance of publications and congresses and conferences that we're having about it, because there's so much changing and so much to learn. To me, this really does point to the fact that we are hot on the trail of solving this. We are going to get patients, we already are, getting patients better than they've ever been before, longer and more safely than ever before. So I think this is only the beginning, and this is probably the worst we're ever going to be at taking care of this disease, which is really, really exciting. My big things right now, I'm focused a lot on the microbiome. I'm fascinated by this. I think the microbiome story is one of the big pieces of the puzzle that we haven't fully filled in yet, and there are many ways we can manipulate it. Things like healthy diet and good sleep, of course, is part of the story. And of course, taking care of that inflammation is part of the story. So we're always affecting it. But now we even have new things that can more directly address it. Topical sprays that can very specifically and selectively kill Staph aureus. Topical probiotics that can actually add the good guys back. Prebiotics that can feed the good guys. So I'm fascinated by this whole area. I think that's going to be super important. And for many of my patients who are already on a biologic or on a powerful systemic medicine but need something more, I love the idea that these could be adjunctive. These are going to be supportive. And I'm always interested in looking at that domain.